and our next guest is Rabi Tawil, Dr. Rabi Tawil, and he's the co-director of the FSHD Clinical Trial Research Network, or CTRN, as it's easier said. And we welcome in Rabi now. Hello, how are you doing, sir?
Good, I'm doing fine. How are you?
I am doing fantastic. I am getting so much scientific information over this morning that my head may explode. So I'm hoping that you can fill it a little more. I got more room in there because it is so exciting to hear about the clinical trial research network and all the other things that are happening within the FSHD community. And you're a huge player within this, working out of the University of Rochester Medical Center. So tell us a little bit about maybe current researches or things that you want us to know. Let's put that on the front burner.
Yeah, so the Clinical Trial Research Network really started in 2015 with private funding for about 4 sites, and got a lot of support after that from the FSH Society to expand the number of sites involved. And this was instrumental in us getting an NIH funding to do the RESOLVE study. The RESOLVE study is really kind of a turning point. It's the largest clinical observational study in FSH, the largest natural history study of FSH that has been done. And again, and at this point we have 8 clinical trial research network sites that are involved in the RESOLVE study. The RESOLVE study is going well with the participation of all of the patients and the support of the families of patients with FSH. We've been able to recruit all of the patients that we needed for the study.
Okay.
We've been able to expand our network to 12 sites now in the US. The 4 sites are not involved in the RESOLVE study, but are being prepared for getting involved in future studies and clinical trials as well. We've also been fortunate to be able to have 3 European sites join us. And so despite the fact that the COVID kind of interrupted some of our research study, but in the end, we're going to have a lot of patients that are going to have undergone the same evaluations for, initially it was planned for 18 months, but it's going to be now 2 years.
Wow.
And so what we learned from the RESOLVE study is we're trying to figure out how fast. We know that individuals with FSH kind of progress at a different pace. It's not all uniform. We want to understand that a little bit better. What are the factors that affect how fast somebody progresses over time? Can we categorize those people? At the same time as we're doing that, we're learning about ways of measuring change over time. It could be direct measurement of strength, or some other, what we call biomarker. It can even be just a questionnaire that the patients take. And because of kind of the size of our study, also all of the impending clinical trials, we've been fortunate to get support from pharma. Fulcrum, for example, added one important outcome measure to our study. And this is measuring function of the arm of the shoulders, basically, using kind of a Connect 3D evaluation of the space that you can cover with your arm. Also, again, because of the importance of what we're doing, and really this is kind of critical for any future trial. We also got support from one of the other pharmaceutical companies to expand again to an additional 3 European sites And so in the end, we will have evaluated about 280 to 300 individuals with FSH. So this is going to be very valuable data. We're starting to look at that. And we're very optimistic that we're going to get some important data out of this study.
Mm. It sounds like the value of that trial network. I mean, what impact has that created in speeding up the development of treatments, do you think?
I mean, the fact that we're doing that and we're developing outcome measures makes FSH more visible to different companies and increases the interest among different companies in trying to in kind of taking on FSH as a disease that is ready for clinical trials.
You mentioned that it's growing. You said three more, right, in European countries, if I jotted my note down properly. And how did that come about? You kind of alluded to some, financial support. Did you want to, kind of stretch that out and talk a little bit about how important it is, for the funding, for the support, if it's days like today or outside funding?
Yeah, I mean, the funding is crucial, as is the participation of all of the individuals with FSH. And we've had, that has been critical. But yes, I mean, every time the NIH funding was critical to start the study, the RESOLVE study. But you have a fixed budget. But when we got interest from other European sites, we were able to get additional funding from them, for them to replicate the study that we're doing here. And again, as with increasing interest from pharma, we were able to extend to increase what we're add to what we're doing here in the RESOLVE study, but also recruit 3 more European sites to do the same study.
What is the current status then of the RESOLVE study? It sounds like there's a lot of promise. It's moving along the path. Can you give us a hot update on where it is?
So we're just about recruited all of the patients that we need. There are a couple of patients that are lined up, and then recruitment will be done. The real challenge is to try to get, there are multiple visits to this. The pandemic is surging again, and there may be sites that are going to close, so it may be a little bit difficult. But again, this is where the additional sites that we have in Europe will enable us to fill any data gaps from visits that we're not able to get from our U.S. cohorts of patients.
So then COVID-19 is kind of being a big boulder in the way at this point. Like you said, you have multiple visits, probably back and forth to the locations, I'd imagine, from patients to the location. And if COVID kind of plays a part in certain shutdowns and limitations of their health concerns. So
and wherever sites are open, there are a lot of measures that all of the medical centers are taking to keep everybody safe. And so if the centers are open, it means access to the centers should be safe. So I encourage all the people involved to go if they have a scheduled visit and their site is open. But when they're unable to do that, we'll do it virtually. We're not going to be able to do the whole assessment virtually, but we'll get some additional essential information for them from the patients.
So in the long process of this, do you feel then that COVID pandemic is going to slow the progress where then it slows the timeline?
No, I mean, if you miss a visit, you can't, keep extending the study. We have to get
Okay. Yeah.
uh, data at certain time points, but we have windows. So, I mean, it doesn't mean you have to come on a particular day. We have usually a couple of months plus or minus that gives us a little bit of flexibility. But in the end, we will get the vast majority of our patients, and any data that's missing in the US can certainly make that up by the data that we're going to get from the European sites.
When it comes to if people want to know, updates or papers that are written about the Resolve study, is there a place that they can go and find that information?
Um, I mean, there's one study about the one paper published about the Resolve study, and just describing what's in the study. Um, um, I can't tell you off the top of my head.
I put you on the spot. Yeah.
Yeah, but they can certainly reach out to any of us, um, here at the University of Rochester, or the CTRN website is based in Kansas City, and they can always reach any one of us to ask for information about the study, we can even provide them with copies of the publication.
Amazing. Okay. Because I know that might be a question that's going to come
Right.
up as people are listening. And you mentioned that you had patient involvement already, or recruitment, or the spots were full. But is there
Yes.
more that people can do? Did they miss out on volunteering for this? But is there other means of the community that can help?
Yeah, so I'm glad you asked that question, because what's coming out of the Resolve study is kind of a more restricted protocol, that's going to be important in the long run as well, that we're going to start implementing very soon. And it's going to be done in conjunction with a person's clinic visit to whatever center they go to. So all of our 12 sites will be involved with that. And this long-term data, it's going to be, obviously it's not going to be as extensive as what we're doing now in the study, but it's going to be an abbreviation of that they can do along with a clinic visit, and we'll be collecting data over at least 3 to 5 years from that. And so we can collect a lot of kind of clinic data that's going to also kind of allow us to add to what we have from the Resolve study, but from regular clinic visits.
So it sounds like that help is still needed. And how can they find, the path to volunteer?
Yeah. So again, I mean, the CTRN website at the University, the Kansas City, University of Kansas Medical Center is the place to go to, and they will find, again, they will find information about what we're calling the MOVE study, MOVE FSH study.
Okay.
And again, this is also important long-term, even after a drug is proven to be efficacious in FSH, because a lot of the companies who are involved, any company that's involved with a drug that's proven to be effective, they need to also be able to follow up patients over time after the study is done, in the clinical setting, to see how people are performing over a long run. Because obviously a clinical trial is going to have a fixed limited time, but again, long-term studies, post-marketing studies that are important for the FDA, to make sure that there are no issues coming up with any drug that's been approved, long-term side effects that may not have been visible in the short-term study that was done.
Mm-hmm. That sounds very key. I mean, that's
Yeah.
The work isn't done once the treatment is found
Right.
safe. Yeah, they want to see the long-term effects. So help is still needed, folks. You still have to help out within this cause all the way through. Any final thoughts you want to share with the listeners before we let you go, Rabi?
No, I mean, you know, we're I think everybody on our side and in you know everybody working research with FSH. I've been doing this for uh, many decades now, and this is really the most exciting time. It took a long time to kind of figure out the mechanism, and things started changing a lot over the last 5 to 6 years. And I think we know from approaches to other neuromuscular diseases that the same can be done in FSH, and some of the others have had some spectacular results. And we're all very hopeful that in the next few years there's going to be an effective treatment. We're very optimistic.
And that's thanks to the
Yeah,
network you've helped create and all the hard work you're doing. And as a community, we say thank you very much. And thanks for joining us today, Rabi,
sure,
on this Giving Tuesday Radiothon event. Your information is extremely valuable, and we do appreciate your time.
sure. Welcome. Happy to do it.